Can you talk about a little bit more what you mean by that, kind of what we can expect in the next few months, if these vaccination rates don't get any better, and what we can do to make sure that we are kind of really mitigating?
You know, I don't think we have to do too much more than look across the Atlantic Ocean and see what's happening in Europe right now. They have had falling immunization rates, including measles immunization rates, across the continent, and especially in certain countries on the European continent. And they now are having a 30,000 times increase, 30-fold increase in measles cases. A twofold increase is a doubling. So think about what 30-fold means. That's going to happen here if we have our immunization rates fall below a threshold. What is that threshold? 95%. Because measles is so contagious, if it gets into a community and fewer than 95% of people in that community are immune to or protected against measles, then it will find those that are not protected, that are not immune, and it will infect them, and it will spread within that community. Of our 50 states in the United States, 36 fall below the 95% threshold, Alabama included. 36 of the states out of 50 are below the 95% threshold right now. Within states, whether they meet the threshold or not, there are pockets of communities, portions of counties even, sometimes even just a few blocks within a neighborhood, where immunization rates might be as low as 40%. If you're living in that kind of an environment, or you even work in that kind of environment, or know people that go to your church that live in that environment, whatever it may be, you and your children are at risk, because we have to have very high, 95% or greater immunity within a population, and that population can be literally 1 or 2 blocks, in order for this virus that's like a heat-seeking missile to not be able to find someone who's susceptible. And once it finds somebody, it will start spreading to others that are not immune as well, that are susceptible as well. So that's where kind of the pandemic effect came in, when we were not able to go to our pediatricians' offices because they were overwhelmed with COVID patients, or because we weren't supposed to, because, for preventative care, that, we were being told in 2020, for example, to try to hunker down at home. And we did that pretty well. But we, as a consequence, fell behind on many things, education included, but it also includes vaccines. Vaccination rates have fallen, and as a consequence of that, we are now playing catch up. And the virus, at least in Europe, is definitely several steps ahead of what their health care system is. In the United States, we're not that bad yet, so we still have time to try to prepare before we get to that kind of a bad place.
All right, and then I'm going to do last call for any questions from those joining us. While we're waiting on that last call, Dr. Kimberlin, did you have anything else that we did not cover today that you'd like to? Oh, we do have one question real quick. Olivia, if you want to go ahead and unmute and ask.
Hi, yes. So I know that I saw something on the CDC. I'm not sure if there have been any cases yet reported in Alabama, but there have been some in our neighboring state, Georgia. So, you know, have you been describing that it's can spread very quickly and very rapidly, and we'll find someone that is not vaccinated. The fact that there has been a case in Georgia, does that bring about any extra concern for people here in Alabama?
I think it does. You know, any measles case, including a cluster in Philadelphia, for example, any of those put us at risk, no matter what part of the country we're in, because, for example, let's think about it. Somebody's flying through and connecting out of DC, for example, and Philadelphia, has somebody from Philadelphia connecting through as well. Then you could contract measles on that plane or in that airport and then return home to Alabama. Now, the more cases that are around us in our neighboring state of Georgia, for example, then that's even closer. So it's even more possible, more likely, perhaps, that in fact we will start seeing it here. The main thing, though, is just how contagious this virus is. For every person that's infected with measles, if they're around additional people who are not infected, for every infected person, 12 additional people will become infected from that one person if they're exposed. even in the very early days of the COVID pandemic, when you know how infectious that was, the number that would be infected from any one given person was 6 or 8. This is twice as infectious, basically, as even those early days of the COVID pandemic were, when nobody had immunity to the virus at that point, the COVID virus at that point. So the proximity is a concern, even though if there was not proximity, when this virus is in the United States, it poses a risk to us all because it's that kind of contagious.
And so for parents of vaccinated children, is there any additional step that they should take to protect their kids? Maybe sending their child to school with a mask on, or, if they have the vaccination, should they be safe, essentially?
If a child has the adequate number of vaccines for measles, MMR vaccines, and the first dose is generally given around 12 months of age, 12 to 15 months of age, and dose number 2 can be given up, as quickly as 28 days later, but generally is at the 4 to 6 year appointment when they're going back to see their pediatrician. So if they're under 4 years of age and they've received 1 dose, if they're over 4 to 6 years of age and they've received 2 doses, they are highly likely to be protected. If you've had 2 doses of the measles vaccine, you have 97% plus likelihood of being protected, of being immune to measles. If you've had 1 dose and you're a younger child, you're 93% likely to be fully protected against measles. If we start seeing a lot of measles circulating in the community, the health department may make a recommendation to get that dose number 2 closer to dose number 1, so we get to 97 faster. But for even 1 dose, 93% is a really, really good vaccine. For 2 doses, 97% is an outstanding response to vaccines. So if they've had adequate number of vaccines for their age, they really should be very well protected.
And I know a lot of parents are sort of choosing to not vaccinate their child because of concerns that it could bring about other issues for their child in the future. To your knowledge, has there been any findings of this being true, or, is this vaccine essentially just safe? And, should there be any concern for parents, I suppose, about this vaccination?
This vaccine is a very safe, highly effective vaccine. I'm 60 years old. I was born in 1963. The vaccine was introduced to the American public in 1963. It has been used for the entire 60 years that I've been on this planet. And it is a very, very safe, very, very effective vaccine. Measles, on the other hand, 1 in 5 people who contract measles will be hospitalized. 1 in 20 people who contract measles will develop pneumonia. 1 in 1,000 people who get measles will have swelling of their brain, the encephalitis we talked about before. Measles is a very dangerous virus. The MMR vaccine is a very safe vaccine.
I believe that was all I had, so thank you.
Thank you, Olivia. Do we have any more questions? Give it a second. All right. Well, Dr. Kimberlin, do you have any closing words for us?
I just want to thank everybody for being with us today. This is not a hair on fire moment yet, but it has the potential to become one. And the best time to prepare and prevent such an occurrence is before it actually becomes that kind of chaotic situation. So I appreciate very much y'all taking time and considering how to amplify this message so it gets out to as many people in our community as it can, and then they can make decisions for themselves, working with their doctors on how best they can protect their families.
All right, thank you. And thank you for everybody who joined us today. I will be sending a follow-up with the recording for this in case you didn't get it on your side. Dr. Kimberlin, thank you so much for your time, and I hope everybody has a good Friday.